Hi, good night, guys. Hope all is well. I'm just going to give you a case with regards to peripheral artery disease, and feel free to correct me if I say anything wrong. It's just a case that I thought was really interesting when I was studying for the MRCS, and for some reason it came back up in the history station. So it's a patient who was a 50-year-old male. They presented, it was a 50-year-old Caucasian male, right? Most of your patients will be Caucasian or, yeah, Caucasian. So 50-year-old male who presented with pain in the leg after walking 25 to 30 feet. You're asked to take a history from this patient. Now, very important things you need to take from this patient's history. For one, you need to get their name. Usual demographics, age. You want to know if they have any chronic illnesses. Well, prior to just before that, you'll know they're presenting complaint which they would have already told you in the case. Then afterwards, you will want to know if they have any chronic illnesses, like I said. So it should be hypertension, diabetes, as well as a history of peripheral artery disease or even hypercholesteremia. Okay, you want to know what medications they're taking. So you gotta get it out of the way right away. After that, there you go into their symptoms, which should be like they tell you that they can't walk more than 25 feet. They have to stop, breathe, rest. Then they have to start back over, and every 25 feet they have to stop, breathe, and rest. You want to know about rest pain. For instance, if they have to wake up in the night to hang their foot off the bed so that the pain would stop. If the pain wakes them up at night, you want to know the onset, position, quality, duration of pain. You know the usual OPQRST, OPQRS, and aggravating relieving factors. So once you've gotten that, you want to also know their diet, if they're a smoker, how much they smoke, the pack years. Um, One major thing that you need to know is if you notice the foot has gotten darker, if they've lost any feeling in the foot, if they notice, for the exam, you don't have to ask about if they've noticed, for instance, flies buzzing around the foot, because in some instances, peripheral artery disease can result in, gangrene. And for in a worst case scenario, you can have meiosis, but you don't need to ask about that. But in the real practice, you need to ask them if they notice, for instance, a wound that's non-healing. If they have a wound, you need to ask them, has it rapidly gotten large in a short space of time? I don't know if I've left out anything. Drinkers, smokers, if they notice that, if they've had a history of abdominal aortic aneurysm, although abdominal aortic aneurysm present much different from peripheral artery disease in the sense that when it's an emboli from the abdominal aortic aneurysm, the emboli goes through the microcirculation and causes trash foot or destruction of the microvessels and decreased blood flow to that area. So if you have an abdominal aortic aneurysm and, for instance, your foot starts to turn dark, chances are it's not peripheral artery disease. It's more so to be an emboli, because the abdominal aortic aneurysm actually throws out clots because there's stasis within the aneurysm. How do you look for an abdominal aortic aneurysm? We'll get to that in the examination stage. So you go to the past medical history, as you've already covered before, any past surgeries. For instance, you want to know if they've had, for instance, any venous stripping, which is, I know it's the venous side of circulation, but you still want to inquire about any previous surgeries. You want to know if they have had any interventional procedures. So those would include, for some reason it slipped my mind, endarterectomy, I think is the word, sorry. Endarterectomy, any form of microvascular procedures. And once they're probably going to tell you no, they've never had that. They'll probably tell you that they don't take their medications regularly, and if they do, they don't take it properly. That's just part of the case. Past surgeries, allergies, usual family history. Do you have anybody in your family who has died recently from a myocardial infarction? Have you ever had a myocardial infarction? That will be covered back in the history presenting complaint. That's something I forgot just now. Social history, we've already covered that. Smoking, drinking, fast foods or foods high in cholesterol. Now the examination, what you would like to find in the examination, maybe it's history station, but this is just for your general knowledge. In the examination, you want to examine their cardiovascular, respiratory systems. Cardiovascular system, you're listening for murmurs, displaced apex beat, not listening, but you're feeling for a displaced apex beat, any thrills or parasternal heaves, any pedal edema you're looking for as well too, any basal crepitations, any sign of CCF or history of which would probably point to an MI or any other condition that could have caused them to go into CCF. You also want to look to see if for the abdominal examination is also very important. You want to look to see if they have any pulsatile expansile masses on their abdomen. In the abdomen, pulse expansor mass in the abdomen as well as the femoral region. Don't forget the femoral region or the popliteal region, because you can have aneurysm straight down. You want to see if there's any sites for possible thrown out of emboli. The next step would be to, I didn't remember to mention pulse, but you would do that in the cardiovascular examination to see if there's any radial to radial delay, which could point to coarctation of the aorta. Now, for this patient, peripheral vascular examination is very imperative. You need to do pulses. So you need to do pulses straight down. Radial, brachial, femoral, popliteal, dorsalis pedis, as well as the posterior tibialis. Now, once you do those, they may ask, what would you like to do next? They will say ankle brachial index. Please remember that even if you get an ABI of greater than 1, it's just hypothetically, if you get an ABI of greater than 1, that patient could, if they're diabetic, please remember that diabetics can have calcification of the vessels resulting in an ABI index of greater than 1. So once greater than 1 doesn't necessarily mean that they're not compromised. It could mean that they have calcification of the vessels. So just keep that in mind. Now they'll ask you what else you would want to do for this patient. You will say lots of things: duplex scan, CT angiogram. See, a lot of the consultants here like to do CT angiograms. It's kind of like that thing you do just before surgery, if surgery is indicated, because you might want to do like a fem-pop or femoral distal bypass graft or aorta distal bypass graft, anything like that. Now, peripheral artery disease. All right, I'll have to give a part 2 of this video.